Thank you very much. A great thanks to you, President Tajani, and also MEP Bourgeois for joining us today, especially President Tajani, who is chairing the group, and we're really greatly honored and very thankful that you can do that together with us. Now here, I'll give you a short overview about the work of UEG. UEG is a scientific umbrella organization aiming to improve digestive health, and we're uniting about 30,000 specialists from every field of digestive health. So when we look at digestive health, chronic digestive diseases are long-term disorders of the digestive tract and include digestive cancers, chronic liver disease, inflammatory bowel disease, celiac disease, food allergies, functional disorders such as irritable bowel syndrome. And digestive diseases continuously inflict a heavy healthcare and socioeconomic burden throughout Europe because they often affect patients at young age and have a significant impact on society, resulting in a loss of economic productivity through both physical and mental burdens. Now, key contributors to the alarming increase in prevalence of digestive disorders include the aging population, environmental factors, unhealthy diets, including foods high in salt and fats, lifestyle factors such as alcohol consumption, smoking, and lack of exercise, inefficient primary prevention, diagnosis and treatment programs, and lack of research funding into diagnosis, prevention, and treatment solutions for digestive diseases. So here you can see a graph about the prevalence of digestive diseases across Europe. Digestive cancers are responsible for about 28% of cancer-related deaths in the EU, and the cost for colorectal cancer treatment is about 30 billion euros per year. Chronic liver diseases has been estimated to affect almost 30 million people in the EU, and IBS, not a deadly disease, but a very troublesome disease, affects about 1 in 10 people in the EU. So it really has an enormous burden on our healthcare system and on people's well-being. Next slide. Now, nutrition, obesity, and the digestive health. This has already been mentioned both by MEP Tajani as well as MEP Bourgeois. A multitude of digestive diseases have been attributed to unhealthy diets, malnutrition, and obesity, and are consistently linked to digestive cancers, inflammatory bowel diseases, and celiac disease. NAFLD, non-alcoholic fatty liver disease, is the most common liver disorder in Western countries and has become a public health concern worldwide. And studies demonstrate that obesity can increase the risk of colorectal cancer by 50%, particularly in men. And here, MEP Bourgeois already pointed to that digestive health in children is really, really important because it's the next generation. And if you get a bad start, this might hold on throughout all of your life in the future generations. Here you can see overweight in children. About 30% of children are overweight. So 1 in 3 children in Europe in school age are already estimated to be overweight. And here, important and early action is needed for a long-term benefit. Alcohol and digestive health. The European region has the highest level of alcohol consumption in the world, and as a result, the highest proportion of total ill health and premature death linked directly to alcohol. Alcohol consumption is a risk factor in over 60 types of diseases, with nearly 25% of deaths from GI diseases directly attributable to alcohol. So about 50% of all liver cancer cases, for example, in Europe, can be attributed to alcohol. 1 alcoholic drink per day increases the risk of esophageal cancer significantly, and between 1 and 4 alcoholic drinks a day increase the risk of colorectal cancer. So there is a great link, not only with cirrhosis of the liver, but also with digestive cancers. And you see the 5 most common digestive cancers in the EU are colorectal, gastric, pancreatic, liver, and esophageal cancers. And as said before, 28% of cancer-related deaths in the EU are attributable to GI cancers. And more importantly, approximately half of all cancers are preventable, and their significant burden could be reduced by addressing lifestyle factors such as alcohol consumption, smoking, diet, and exercise, and through the widespread implementation of screening programs. Functional GI disorders have been mentioned. There are a group of chronic and recurrent GI conditions where symptoms and treatments are not easily identifiable, like irritable bowel syndrome, constipation, functional dyspepsia, and as said, about 1 in 10 people in the EU are affected by these disabling conditions that have a major social and economic burden. So here, when we look at colorectal cancer screening, one of the more important issues that the EU Commission wants to address in this legislature here are the OECD data, health statistics, screening and survival for colorectal cancer. You can see that the colorectal cancer screening programs are highly heterogeneous throughout the EU, with countries like the Netherlands leading with about 70% of the population screened, while other countries, and we're not necessarily talking about just Eastern European countries. Look, for example, at Spain, that has a very low and incredibly low screening rate for colorectal cancer, with the resultant negative impact on colorectal cancer cases. Also in the lower panel, you can see the improvement in 5-year survival for colorectal cancer, how it changed over the periods. And you can see that in countries, for example, like Italy, over the period of 10 years, there was an improvement in colorectal cancer survival, 5-year survival, 64%, and improvement in the last 10 years, while in other countries, for example, Romania here, your survival is only 52% at 5 years and no improvement over the last 10 years. So there's great heterogeneity and there's important action for policy here. Health expenditure relative to GDP is also very different amongst different countries. I'm just highlighting here my home country, Austria, where about 10% of the GDP goes into healthcare, while on the other hand, another up and coming big country in the EU, Poland, has just 6.2% of its GDP going into health expenditure. And that, of course, creates great differences in healthcare delivery, prevention, and screening programs between those countries. Next slide. And when you look in particular at digestive diseases, you can see that, of course, a lot of money is allocated to different disease areas. Circulatory diseases, cardiovascular money, and that is probably also justified. But you can see that actually digestive diseases that are so prevalent are getting a relatively smaller share of budgets for treatment and prevention. And therefore, we do believe that political action is needed to put digestive diseases further up on the list when it comes to research and patient care. So, to sum it up, rising to the challenge, Europe is currently failing to manage the increasing burden inflicted by chronic digestive diseases. And despite their prevalence and impact, many digestive diseases remain poorly understood, attract too little political attention, and can be extremely underfunded for both research and patient care. UEG and the Digestive Health MEP group thus calls for urgent steps to be taken to improve awareness of chronic digestive diseases, to put digestive health firmly on the EU agenda and reverse the current trend.